Okay, so you know how we were talking about pain before? Well, now we're going to like zoom out a bit,
Yeah.
like look at all the different things that can make you feel, well, not so great.
Yeah, exactly. And we're going deep, like really understanding where these symptoms actually come from. We've got some really interesting sources for this.
Oh yeah, like what?
Well, there's this home care manual, super practical, made in South Africa, right when COVID was hitting hard. And we've also got these clinical guidelines from the Hospice Palliative Care Association of South Africa. Pretty official stuff.
Okay, serious sources.
Yeah.
So where are we going with all this? What's the mission today?
Basically, to figure out why we get symptoms, what causes them, and then we'll talk about how to deal with them, both with medicine and without, a whole toolbox of
I
options.
like that. Toolbox. So first things first, what did our sources say about, well, what palliative care actually is?
A lot of people think it's only for the very end, like hospice care. When you're,
Not doing so well.
right, exactly. But actually, it's way more than that. The ideas behind palliative care, they can be used much earlier.
Oh, interesting. Like as soon as you get diagnosed with something serious.
Exactly. Our sources are pretty clear about that. It's about improving your quality of life throughout your illness, not just at the very end.
I see, I see. So it's about living well, even when you're sick. That makes a lot of sense, especially for our listeners who really want to understand the whole picture.
And that actually brings us to a bigger point about healthcare decisions, especially tough ones. The South African Home Care Guide talks about this, during crises like COVID when resources get stretched thin.
Yeah, that must be super difficult for everyone, like not enough of everything to go around.
It is. They talk about these ethical dilemmas like, what do you do when you can't help everyone in the best way? They even mention triage, trying to be fair about who gets what.
Oh, like when a hospital only has so many ventilators and they have to decide who gets one.
Exactly. It's a way to try and be as fair as possible, even though it's never perfect.
Wow, that puts things into perspective. So in those situations, being able to care for people at home and manage their symptoms well, that becomes even more important.
Absolutely. Our sources really emphasize that. Lots of folks, even recovering from severe illnesses, might need a lot of support at home.
I imagine the amount of support varies a lot, right? Like depending on the person or their family.
Oh, for sure. It depends on so many things, like what's their home like? Do they have
Mhm.
help? Do the family members understand what to do? The guide's really big on communication, like having clear talks with families before someone goes home from the hospital, making sure they know about infection control, how to handle symptoms, all that.
Yeah, that makes sense. So let's talk about actually managing symptoms. What about the medical stuff, the medications? Our sources mention these continuous subcutaneous infusions using syringe drivers. What are those all about?
So syringe drivers, they're actually pretty cool. Imagine a small portable pump that delivers medication continuously. It's great for folks who struggle to swallow pills or liquids.
I see. So it goes right into the bloodstream.
Yeah, just under the skin. And a trained healthcare professional, like a doctor or hospice nurse, can set it up at home, teach the family how to use it.
That's amazing. So
Yeah.
what kinds of meds are we talking about? I know the guidelines list specific ones for different symptoms, like for agitation or delirium. There are a bunch mentioned.
Right, you've got holoperidol, risperidone, olanzapine, quetiapine, ziprasidone, though they do point out that haloperidol can be hard to get sometimes, so it's good to have backups.
Got it. What about for pain?
Morphine's the big one. They say it can be given orally as an injection, even sprayed into the mouth as a mist if someone really can't swallow.
Wow, that's versatile.
It is. They also talk about fentanyl patches, but they stress careful dosing because it's strong and it takes a while to kick in.
Makes sense. So what if these syringe drivers aren't available? How do you give meds to someone who can't swallow?
They talk about subcutaneous bolus injections, which is basically a one-time shot under the skin. They say it's important to contact a doctor or nurse who can help get things started.
Okay, that makes sense. Now, what about other symptoms? Like restlessness, anxiety, nausea, vomiting.
For those, they mention haloperidol again for restlessness, midazolam injections for anxiety, and metoclopramide for nausea and vomiting.
And for end-of-life symptoms, are there specific meds for that?
Yeah, they go into that too. They talk about using metoclopramide for nausea and vomiting, hyoscine butyl bromide for noisy breathing for mucus, and then a bunch of options for agitation and restlessness like lorazepam, diazepam, midazolam, and even haloperidol again.
That's a lot. And they keep stressing having backup medications, just in case.
Absolutely. You never know what might be available when you need it.
Right. But medication isn't the only answer, is it? Our sources also talk about non-medical ways to manage symptoms, like what about shortness of breath? What can you do for that?
It's amazing how much simple things can help, like propping someone up with pillows, keeping the room calm and quiet. Even a cool breeze on their face can make a difference. They also suggest relaxation techniques, like slow breathing and relaxing your shoulders.
That makes sense. What about anxiety and agitation? What helps with that?
They say it's super important for family to stay calm and reassuring. And of course, checking for anything physical that might be bothering them, like a full bladder or constipation, making sure they're comfortable.
Right. And for people who are bedbound, that's a whole other set of challenges. What do our sources say about that?
They actually have a lot of practical advice for families, like how to wash someone in bed safely, how to prevent pressure sores by repositioning them and checking their skin, even massaging to improve blood flow,
Wow, that's detailed. What else?
keeping their mouth clean, helping them use the toilet, making sure they eat and drink enough. They even talk about how to give meds to someone who can't swallow pills, like crushing them and mixing them with a little bit of soft food.
That's good to know. And as someone gets closer to the end of life, what can families expect?
Well, the sources describe some of the common changes, like increased sleeping, maybe more confusion, less talking, and changes in hearing. They say to let the person rest, reassure them, speak clearly and slowly, and keep the environment peaceful.
And what about food and drink?
It's common for people to want less. Just offer soft foods and sips of water if they're interested. And if they can't swallow anymore, just moisten their lips.
Okay, so besides the physical stuff, our sources also talk a lot about emotional and spiritual support.
Oh, yeah, that's huge. They encourage acknowledging the impact of illness, seeking counseling, and drawing strength from spiritual beliefs or practices, whatever those may be.
Right, and they mention resources like hospices and primary care.
Yes, and they even talk about phone or online counseling, which can be helpful when it's hard to get out.
For sure. They also talk about stigma, which I think is really important.
Absolutely. They explain how negative attitudes and beliefs about illness can really hurt people, make them feel isolated, and prevent them from seeking help.
That's so true. And what about the caregivers? They must be under a lot of pressure.
Oh, definitely. The sources talk about the need for information and support, mentioning things like support groups, social workers, psychologists, counselors, and hospices.
Takes a village, right?
It really does. And finally, they touch on these palliative care emergencies, things that need immediate attention.
Yeah, they mentioned some pretty serious stuff like high calcium levels, bleeding, spinal cord problems. Scary stuff.
It is, and we won't go into detail here, but it's good to be aware that those situations exist and need quick action.
Absolutely. So the big takeaway here is that understanding symptoms, where they come from, it involves looking at so many things, both medical and non-medical, and having a wide range of tools to help.
Exactly. And all of this falls under that broader umbrella of palliative care, which is really about making life better no matter what stage of illness you're in.
And it's about the whole person, right? Not just the physical symptoms.
Right. It's about their emotional, social, and spiritual well-being, too. It's complex, especially when you're managing things at home, and support is so crucial for both the person who's ill and the people caring for them.
So thinking about all of this, the physical, emotional, and social stuff, what small change could you or someone you know make today to improve comfort and quality of life no matter what your health is like right now? It's something to ponder and maybe even explore some of the resources we talked about today. Thanks for joining us on this deep dive.